8105. For the Spanish-speaking community, para la comunidad en español, mi número es 917-836-8105. One more time, 917-836-8105.
All right, gracias, thank you, and lots of people say how great you are, so thank you very much.
Take care.
Bye-bye, see you soon. We had another caller this week, a man with a Gleason 9 cancer. Gleason 9 is how aggressive the cancer is. There's a scale of 2 to 10. The lower the number, the less aggressive. The higher the number, the more aggressive. This man had a Gleason 9. His doctor said, you have a Gleason 9, and I booked you for surgery on Tuesday.
Wow.
For robotic surgery. So what's the data?
Surgery.
Puppet surgery. So what's the data? What's the likelihood? Well, this man fell out of his chair when he heard the fact that with surgery, robotic surgery, or open surgery, in the best hands in America, the likelihood of being cancer-free is only 23% in the best hands. I'm not talking about average hands. Wow. 23%, meaning 80% of men have recurrence of their cancer with robotic surgery.
I can't say I want those stats on my side.
Our data for Gleason 9, it's in our booklet, along with the data I just told you. Our data is on page 15. This is our data for 3,000 men. If you've got a Gleason 8, 9, 10, our data shows a 70% chance of being cancer-free, and that's even without hormones. If you add hormones, it's higher. But we're talking about 20% versus 70%. So you can obviously, where would you choose? The place with 20% success?
Or without a doubt, 70%.
Right. And furthermore, there's an article showing that the success in keeping sex life with robotic surgery or open surgery is very low. What percent of men have normal sexual function, no problem after surgery with robotic? Do you remember that number?
I don't, but it was somewhat it was very low.
2%.
Yeah, I was going to say 5, but yeah.
Okay, 2% have no problem after robotic surgery. That means 98% of people do. And there's also other issues with robotic surgery, which we'll report on another week, and that is the complication rate, perforation rate, and the fact that the government is coming after robotic surgery because they are not reporting their complications. One other thing I wanted to talk about in the prostate cancer department was where you get treated, even with the same so-called treatment. Let's say you get brachytherapy and radiation. Brachytherapy means we put radiation seeds through the skin. They allow us to give higher doses of radiation to the prostate. In our facility on 38th and Broadway, we have our own operating room, own anesthesia, our own recovery room. So you just walk in, get the treatment. It takes about 45 minutes. Wake up, put on your pants, and get out of here.
Out the door.
Which is a lot better than being elsewhere, including in a hospital. Now, if you had... I just want to go to this data, and I'll find you the page. Page 17 of our prostate booklet, and we'll mail this booklet and DVD to you at no charge if you call us with your name, address. No problem about that. If you have intermediate risk, let's say you have a low PSA, but a Gleason higher than 6, meaning Gleason 7, 8, 9, 10. If you go elsewhere to a famous hospital in New York, their success rate is 72% cancer-free survival.
Okay.
Ours, if the same patient with the same numbers comes to us, it's 92%.
Wow.
So not all treatment is the same from place A to place B to place C, and we urge people to look at the data before you choose. Certainly look at the data before you get sucked into robotic surgery. It does not seem to be the miracle cure that people are alleging. And we even have a letter here from a doctor who's director of robotic surgery at a big cancer hospital nearby. And he wrote this about a patient. He said, Mr. X was most interested in learning about surgery for prostate cancer, in particular robotic procedure. I explained to him the details of the operation and anticipated post-operative course. I reviewed the short and long-term. This is the surgeon's words to the patient. I reviewed the short and long-term risks of surgery. What did the head of surgery, robotic surgery, say about prostate surgery at his big cancer hospital? Side effects include, but are not limited to, infection, bleeding, deep venous thrombosis, pulmonary emboli, bowel injury, rectal injury, ureter injury, cardiac or respiratory problems, penile shortening, urethral strictures, incontinence, infertility, and impotence. Lastly, quote, this is a surgeon explaining. He's the head of robotics. Lastly, I explained that while I prefer robotic approach, there is no convincing study demonstrating clear superiority over either open or conventional laparoscopic prostatectomy. So why are they doing it?
Yeah,
it costs millions of dollars to buy the machine. There's all these complications. Why the heck are they doing it? And we have data to show their results are inferior. So why are they doing it? I call it betrayal, and it's on my list of betrayal because I think it's really betrayal when they're leading people on that they say there's 98% success rate, that everyone's sexually functional, everything's great, and then you look at the data and you have the words of the surgeon himself.
Directly from the
I mean, why would you get all these complications?
Yeah, it didn't
described?
sound so. Not a list I want.
And why would the head of robotic surgery say that there's no benefit? Why would he say that?
Maybe because he has to, Doc, and that's...
Well, he maybe has to on paper, but
Yeah.
does he say the same to the patient to their face?
Right, who knows?
I call it betrayal, and
Yep.
we have a list of sad betrayals. Also, we had a little girl come in this week who had tomotherapy. People often ask us, well, what's the difference between tomotherapy, cyberknife, and what you do, Dr. Lederman? We were the first to do body radiosurgery in the Western Hemisphere. Well, this little girl had 28 treatments on tomotherapy. Tomotherapy does a CAT scan on the patient every day. And sometimes they do 2 CAT scans. Of course, they charge for it. So you can imagine this little girl had somewhere between 28 and 56 CAT scans to line her up when there's technology that doesn't require CAT scans. It doesn't give you radiation. If I came and told a patient, wow, you're going to be getting somewhere between 28 and 56 CAT scans over the next month for treatment, they would go nuts.
Sure.
And I think that often people are not told what exactly they're going to get into. So we're getting near the end of the hour. We still have a long list here. We're going to continue on. We have 2 shows on WOR, one tomorrow at 6 to 7 a.m. We're going to continue on this list. And also we have a stack of new cancer news to try to make your life better and more sane and not spend money on things that may well harm you or certainly may not help you. We have Dr. Paul Offit, the author of Do You Believe in Magic, tomorrow night on WOR from 9 p.m. to 10 p.m., and we'll be taking your calls. So if you have questions during the week, call me directly at 212-CHOICES, 212-CHOICES. That's 212-246-4237. This is Dr. Lederman. I'm running to pick up my son who's flying in from L.A.
Yes.
Have a great week. Thank you, John.
Thank you,
and
Dr.
all
Lederman.
of your listeners, God bless you. Have a great week. And looking forward to meet you in person.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212